Hi, I'm going to perform an airway clearance device. So first and foremost, we check the patient's chart and then obtain any important information. And then once inside, we introduce ourselves to the patient and then we should explain to the patient what's the purpose of this one, such as telling them that this would help or prevent any collapse of their lungs, reduce or clear up their secretions, and also clear up their airways. So once we're done, we proceed in checking the patient's ID band to confirm the correct patient, and then we position the patient, such as maybe if they can position in an upright position, and then they should rest their elbows in a table, or they can be just putting up in the sides and should be comfortable. And then first is we also have to make sure that we do our pre-vital signs, and then once we're done, we wash our hands and then we proceed in explaining on how to perform the device. So first is we always make sure we set the appropriate resistance in the lowest level in the negative side initial trial, especially if we started it with a elderly patient. And then with here, make sure we also have a mouthpiece, and also we make sure we have prepared a mask in place to make sure if some patients who are not able to tolerate using a mouthpiece, we can shift it with a mask. So when doing this, we make sure that we position it with the hands like this. We should not obstruct it because the flutter valve will be blocked or obstructed. And then we also let the patient know that when doing this, they have to take a deep inspiration, and then they should do a strong exhalation. And then once they do an exhalation, they will notice any obstruction inside, and then if they sense any obstruction, they should continue it after 3 to 4 seconds of exhalation, and then they should remove their mouth from the mouthpiece. And then if they can expectorate some sputum or phlegm, that would be better. So now, if we started it for the patient, we can also let the patient just relax. We can also hold it with ourselves. So let the patient take a deep inhalation, and then exhale with strong exhalation. Exhale, and then if they sense any obstruction, just continue, and then after 3 to 4 seconds, okay, remove. And then if the patient can cough, we can aid them, let them cough, and then we should have a basin in place so that they can expectorate their sputum or phlegm on the basin. And then another thing is that every time we do this, we educate the patient to not wash this device, and then we should allow this to air dry, and then we have a big safety bag in place to prevent this from falling down. And then we should also instruct the patient that with this device, they should not do it synchronized with a nebulization treatment because it will lead to clumping on the flutter valve. So they should do it every after nebulization. And then after that, you can hang it on the patient's bed, and then we should let the patient instruct them to do this not just only every after nebulization, but if they can do it every hour, so that it will help them to have a strong cough reflex. So once we're done doing this, we're gonna wash our hands, remove gloves if we're wearing or if applicable. Then we do post-vital signs, and then make sure we observe the patient, everything. And then another important thing in doing this device is that if the patient complains dizziness every treatment, we should terminate the therapy, and then we should let the patient stabilize. And then once everything is done, go outside, explain everything to the nurse station, and if the physician is present, that will be better. If what's the initial impression without therapy, and then I think we're good.